Ladies and gentlemen, today we are inviting you for a special project. This project is how psychotherapy helps people with their emotional and family problems. My name is Dr. Sohail. I'm a psychiatrist by profession and I practice psychotherapy in my creative psychotherapy clinic. Just to give you a little bit of background, I grew up in Pakistan and I graduated from Khyber Medical College. And after that, I came to Iran and then later on moved to Canada and did my training in psychiatry at Memorial University, Newfoundland. After doing my fellowship, I worked in different general hospitals, psychiatric hospitals, moved to Ontario, and then started my own clinic that we call Creative Psychotherapy Clinic, in which we developed a special program, a self-help program that we call Green Zone Living. So today we will talk about psychotherapy, we'll talk about Green Zone, and we'll talk how therapy helps people. The idea of this project came to me when I was visiting Pakistan a few weeks ago, and I met my dear friend Dr. Ali Hashmi, who used to live in States but has gone back to Pakistan and is a very dedicated psychiatrist who teaches in a medical college. So when I was in Pakistan, he introduced his students. He brought the students for a lunch, and I talked to them, and there was a great enthusiasm with them how to learn psychotherapy, because as you know that many psychiatrists, they just prescribe medications. They don't have that much time to sit down with their patients and talk. So they were asking me what kind of therapy I do and how I can help them. So when I came back, I asked some of my patients who I thought were good role models for psychotherapy and asked them if they will share the stories, how psychotherapy helped them and how it helped their families. So this project is basically of mental health education. We hope that this interview and a series of these interviews will help people who are struggling with emotional problems, help their families. It can help the students who are learning psychotherapy. It might help mental health professionals, doctors, nurses, social workers, occupational therapists, so that they have an idea what psychotherapy is and what are the dynamics of it and how it sort of inspires people to become better human beings and create a peaceful life for themselves. So our first person today that I invited is John, and he has been very kind enough to join us in this project. He is a retired teacher, and I felt that he was a very good candidate who learned from psychotherapy and who uses it. He practices it. It's not just a talk. He practices it in his day-to-day life. So I think he will be a good role model for many people and hopefully will inspire many people, especially men, so that they do not feel that because they're men, they don't have to express their feelings, they don't have to go and get therapy, so that this macho image or this sort of male kind of upbringing can sometimes hinder us from getting the help that we need. So John, thank you very much for joining me in this project, and this is your way of sort of helping other people and contributing to men in particular and general people in general. So how did you feel when I invited you for this interview?
I was excited. It was a good opportunity to pay forward for the understandings and healings that I've received.
So share with me, when was the first time in your life, how old were you when you first saw a psychiatrist and what was your experience with that?
I was in my mid-30s at the Clark Institute in Toronto. I'd had problems in my first marriage, and there were very serious mental health problems on the other side that affected me. But that therapy was some Gestalt therapy and medication, which didn't help me at all. I basically ended up 3 years later in the same point.
And share with us that what were you struggling with when you came to Creative Psychotherapy Clinic?
Well, I was in a bad relationship. I'd also been carrying on an affair, which was a very negative experience in itself, as it turned out, which I learned later from you.
And sort of how long it took you in therapy before you could start make some real changes in your life?
Well, I worked with you for some time. It was about a year and a half or so before, you know, I was able to really integrate what I learned in a useful way and carry it forward.
So how did that what happened to the marriage that you came to the clinic for?
Um, the second marriage was what I was having difficulty with when I came to see you. And there was a lot of emotional abuse going on. I was unaware of, but I was being abused emotionally and reacting negatively to that instead of setting boundaries, which I learned from you. And slowly I learned to set those boundaries and decide that this wasn't going to work. My partner decided they didn't want to continue the therapy, but I decided for my own well-being that I wanted to continue to learn, which I have. And it's brought me to a very good place with the green zone therapy, which I use actively in my life and in my teaching.
So your marriage, then finally the second marriage ended, and
Yes.
You were then on your own, living on your own.
Yes.
So when you continued the therapy, in the clinic, what kind of things you learned about yourself?
I learned that I needed to set boundaries, to think more positively about myself. I learned that I didn't have to put up with stuff. One of the things that the green zone therapy taught me that I shared with my students later was this whole idea of choice. That you don't have to stay angry or depressed. You can decide for yourself. Big awareness for me was to realize that opportunity to change my attitude was actually inside myself, that I was the one that actually had the control, not the situation.
So you took the green zone concept from your personal life to your professional life.
Yes, I did.
So share with me some experience with the students how you interacted with them and how they responded.
Well, I recognized the benefits because I was seeing the benefits in my own life, and I was teaching computer classes in a school for students who were struggling to get their credits because of their emotional abuse and so on. So I introduced it via my computer classes as an assignment. And the most outstanding example was one day a student came to me in the morning. He was very angry. And I had introduced that day the part about choice and green, yellow, red. So I shared that with him. About 4 hours later, he came back to me and he said, Mr. Jeffrey, it worked. I'm in my yellow. And that for him was a huge change in his life that day.
Good. So let me introduce for a second to the people who are viewing our interview, just to give them the idea, because many of them may not be familiar with the green zone concept. So briefly, ladies and gentlemen, this idea of green zone philosophy, therapy and living, we borrowed it from the traffic lights. The way the traffic lights have a green, yellow and red sort of color, we use that as an emotional zones, that we are in one of the three zones at a certain point. When we are relaxed and we are enjoying life, we are in the green zone. When we are a little upset, a little frustrated, a little angry, we are in the yellow zone. And we really lose it. When we are very angry, we lose control, we are in the red zone. So we help our clients so that they can be aware of what zone they are in and then catch themselves in the yellow zone so that they can go back to the green zone. Because once they're in the red zone, then it's very hard to get out of it. So this is just a brief introduction. Actually, we have a number of books, and I just wanted to show you this Green Zone 7 Steps book that is actually a summary of the books that we have written. And John has been using it in his personal life as well as a professional life. John, I also realized in that therapy that you were going through that you also learned some things about your past. So give me an idea that the therapy, how did it connect you with the past, positive and the negative?
Well, I was born in England in World War II, so I experienced German bombing for 3 years. And it took me actually until I saw you to realize that that had had an impact on me. And I started to realize that I'd pushed down a lot of emotions in my life and just put up with a lot of things. And it basically allowed me to bring those things to the surface and deal with them in a constructive way, which I have.
You had also mentioned that when you came to Canada, you had some difficult sort of times.
Yes, that's partly why I wrote this little comic book, Bullies in a Strange Land, because it documents that bullying. When I came to this country, I spoke with a strong British accent, and I was made fun of. And also because I was in the British system, I already knew how to read, write. And the other students, I think, felt uncomfortable because I was about 2 years ahead of them. And I was bullied physically and emotionally all the way through into high school. And then again in the workplace twice, I was the subject of serious emotional abuse from my employers.
How old were you when you started school in Canada?
I was 7.5.
So you were very young.
Yes.
You had also experienced some other forms of abuse that you struggled through in therapy.
Yes, there was. In the beginning, when I was going to university in Waterloo in the mid-'60s, I was going out with a lady that was in London at Western. And one night I traveled to London in a snowstorm, and I was staying at the Y, and they had one room left. And I got into the room, and just after I got into bed, suddenly there's a black person next to me trying to have sex with me. And it was very traumatizing. And the next day I realized I shoved it down. It was like nothing happened. But then I had a lot of trouble committing to the relationship, and it took all the way until the green zone therapy to bring that to the surface and realize why.
So in therapy, you sort of got in touch with some of your past experiences, and you were able to sort of resolve them and deal with them.
Yes.
Now, after those experiences, I'm sort of curious how you feel that therapy helped you with your new relationship. How are you different when you were dating after that?
Well, because I've dealt with a lot of these issues now, I was able to commit myself completely to my new relationship and not push my partner away like I realized I used to, because I didn't want to be close to people. I didn't want to be hurt. And I didn't trust people, didn't let them in. But this time is totally different. It's been a wonderful experience for me because I'm not afraid to let the other person be close to me. And all of this is a result of the green zone therapy.
For how long you have known your partner this time?
7.5 years.
And what kind of relationship you have with her now?
Very close, very committed, very loving, very supportive.
So you realize that therapy sort of not only changed you at a personal level, it also changed you in how you conduct yourself in an intimate relationship.
Oh, yes, absolutely.
One of the other things you struggled was your relationship with your son.
Yes.
Can you share what he went through and how therapy has helped you with that relationship with your son?
My son is gay. He's in his early 30s now. And I realized that, like my first and second wife, I pushed him away too. I didn't allow him to get close to me either. And I think that and what I was doing in my life had an effect on him because I wasn't there for him as a father. But because I was able to heal, he and I now have a very close relationship, very supportive, and my daughter too.
So tell me, what happened with your daughter?
Well, she was in a relationship with a very abusive person, and she basically blamed me for a lot of that. And I also realize now that from the therapy that I had pushed her away. And recently that's changed. I was able to reach out, and we're reconnecting next week.
Good, good, good. So, if you have to sort of gauge yourself out of 10, where do you think you are when you first came for therapy out of 10, and where do you feel you are now?
I would say about a 2. I wasn't functioning very well at all. Now I'd say about 9.5.
Good, good, good. You also sort of mentioned that alongside therapy, your relationship with your sister made a difference for you.
Yes, it did. My sister was married to an Aboriginal and got into the whole Aboriginal belief system, and she shared that with me. And concurrent with seeing you, the understanding of being able to change the energy in a situation and healing also contributed to what I was doing with you, because it was like an adjunct to what you were doing.
Good, good. Now, sort of at one time you were a teacher, you were teaching in the school system.
Yes.
When did you retire, and how did you sort of change your lifestyle since then?
Well, I retired in June of 2011. For about 4 years, I just relaxed and traveled. But I wanted to do more, so I started writing a column about trains, because that's my hobby. I love to do that. But I also wanted to work part-time, and I drive part-time in a taxi. And about 4 months after I started, I realized that I was taking what I learned with you and sharing it with my passengers. So my taxi was sort of like a portable therapy clinic.
Good, good. So you have become like a wise man who is helping other people now.
Yes, paying forward.
Good, 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 good. So I want to ask you a couple of questions about being a man. How you feel that getting therapy, was it difficult for you that you are a man, or it was easy for you?
It was difficult. It was hard to say how I really felt. I was afraid to let you know how I felt. But once I did, now I wouldn't go back for the world, because it's made a huge difference. I think that a lot of men are programmed that they shouldn't share their feelings, but they're only hurting themselves when they do that. They can be a lot better parents, if they let their emotions come forward.
And what about sort of other men that you sort of meet? Do you feel that they have difficulties either expressing their feelings or getting help that they need?
Absolutely.
Yeah.
It comes out in the conversations, and I can see it in the way they behave. Some of them have drinking problems, anger problems that I hear them talk about, precisely because they don't have an outlet. They can't talk about it.
In therapy, we all sort of encourage the sort of people having their hobbies, having their passion, having sort of serving the community. So share a little bit how your passion with sort of this hobby with trains and planes, how it is for you and how it is for you and your son.
Well, my son and I share a passion for planes. And so we periodically travel out to Pearson Airport and watch planes, and that's sharing positive time for us. And we very often share our pictures on the internet for others to enjoy. And we've traveled, to Australia and a couple of other places together, and On our way to Australia, we got to fly in the cockpit of the plane for a while, so that was a wonderful sharing together.
So now, if you meet other people or people who are watching this interview, what will be your sort of advice or message for people with emotional problems, and especially men? What would, based on your experience, what will you advise them?
I think a good first step would be to write down how you feel. Write a little journal so you can see, get a feeling for yourself for where you're at, and find somebody, a friend, somebody you can begin to talk to. Don't be afraid to let it out, because it's better if you share at least something.
And to go and see a professional, what would you suggest to them, seeing a therapist?
Oh, absolutely. And, maybe go and see one or two until you find somebody you're comfortable with, because, that's a big part of the dynamic between you and I, is that we feel comfortable with each other, because I've experienced other therapists where it wasn't the same dynamic, and that's a big part of the outcome of the therapy.
And in what other way you feel the therapy that in our clinic you felt as compared to other psychiatrists or other practices that you have either experienced or observed?
I like the interactive dynamic nature of it, the fact that we can share and,
You also had some feelings about medications. What is your thoughts about?
I don't think they help. I spent 3 years on Valium, and all it did was dull my senses. But at the end of 3 years, the reason I stopped the Valium was I realized I wasn't going anywhere. I wasn't improving. There was no difference.
One other factor I wanted your opinion is about this, what we call as a combination therapy. We do the individual, we do the couple, the family, the group therapy. How you felt that experience as compared to just one-to-one meeting your sweetheart, meeting your son, how did that sort of experience for you?
Well, I thought that was very useful, because my partner was able to be part of that whole growth process, because if the other person isn't, you move ahead, but they're still back here. It allowed us to grow together. Today, I just sort of wanted to get an overview from you of the whole therapy and all that. Is there anything that I missed that you want to share with the people who are watching this interview? Anything you feel important thing that I missed that you would like to share? Listen to your inner voice. Don't be afraid to say how you feel. And, for men, allowing your emotions to come forward is not a weakness, it's a strength.
So thank you very much, John, for part of this this sort of a discussion. You had mentioned that if people who are watching this, for example, if they watch in Pakistan this video about or on the Facebook, you had mentioned that you would be open for a discussion with the students.
Yes, on Skype or some other medium. Yes, absolutely.
Yeah, good. So thank you very much. We'll leave it here, and I want to thank you at the end for contributing and volunteering your time and your experiences. I'm sure it will be of great help to the students, to other people who are struggling, and especially men who struggle with emotion. So
thank you.